So good morning, good afternoon, good evening to everyone. I'm very excited to be at our FY23 Cloud Engineering xSight. Even more excited today because we have with us Mr. Manish Mohanan, who is the CEO of MediEquity Technologies, who is the IT partner at Science House Medical, about whom we are going to be talking much more in detail today. So Manish, a very warm welcome from everyone at Oracle. Along with Manish, we also have Amit, who is the Vice President IT from MediEquity Technologies. Very excited to have you here.
Thank you, Shivendu, and good morning to all of you. Good morning, Nitin. Good afternoon, Valdemir. Actually, it's been an honor, and we are really happy to be here.
So, before we get into the specifics of the engagements at Science House, can you give us a brief background about what Science House does and what makes it unique?
Yeah. So, to give you a better perspective on this, first I'll share our relationship with Science House.
Sure.
There are three entities here. One is Science House, second is POCT Group, and the third one is Mediquity Technologies Private Limited, where Mediquity is a sister concern of both these companies. And we act as the IT arm for them, where we handle all their IT implementation requirements, other than doing our own independent projects. So Science House and POCT are both pioneers in Central India and Northern India in the diagnostic healthcare segment. They deal in medical and pathological devices. They are not only authorized partners for big ticket brands and resellers for diagnostic equipment companies like Siemens, Abbott, Biorad, Biosystems, etc. But they are also manufacturers of a number of medical devices and regions themselves under the Make in India initiative of Government of India.
And then my next question, Manish, is how are you leading the digital transformation at Science House?
And Mediquity actually altogether currently is managing around 410 labs, which are state-of-art labs, and around 2,000 collection points, and handling a team of around 1,000 people directly for sciences and PhD. This basically gives us a presence every almost 6.5 kilometers where we have some kind of a touch point in Madhya Pradesh, in the state of Madhya Pradesh of India. In the last 1 year alone, we have conducted more than 10 million tests. For such a humongous thing to take place, you not only need high level of automation of equipment and process, actually, you also require a robust IT platform, that can take care of the entire process end to end, right from patient registration up to delivery of reports to the patient on his or her smartphones. So digital transformation for us was not a choice, but rather was a carefully selected fundamental strategy. And my team has been, has successfully led the efforts here and created a very smart and robust IT solution, and also certain processes which has resulted not only in substantial cost control, but has also resulted in delivering a great tool helping the entire operation of the project.
Wonderful, wonderful. That was an excellent insight, Manish. My next question to both Amit and Manish would be: what were the key business and technical challenges you faced prior to Oracle Cloud adoption? I know that you mentioned a couple. Maybe you might want to elaborate on some more.
Mhm. Our project was implemented in two phases. In the first phase, we had done a local deployment under client service server model, and actually initial phase we had around 85 labs we had to do in 51 districts of the state of Madhya Pradesh in India. Now, this was posing a huge maintenance challenge for us, and offering support at these remote locations. It was costing an awful lot of money and was putting a lot of strain on our resources. So we started looking for options and were evaluating AWS to migrate. And it was during this time that our lead development engineer, Gaurav, actually he has been also involved in initially, setting up, and he interacts a lot with the team, with the Oracle team as well. So he recommended to he suggested to check out Oracle as it was offering enterprise edition of MySQL.
Mm-hmm.
So we were, we started evaluating Oracle as well, and internally we had decided a timeline of 3 months to migrate to cloud, whichever platform we choose eventually.
Right.
But suddenly one catalyzing event took place, and it just happened that a lot of our locations started having some BIOS level hardware issue with the local servers that we were using, and we were under tremendous pressure to quickly figure out something, some quick solution, and immediately, actually, because these labs are running in all big hospitals where the hospital facilities were 24/7. So we were under tremendous pressure, and we got in touch with both AWS and Oracle as well. And we quickly figured out that Oracle was a better fit for our requirement, as it was offering us better customer support, and it looked a more viable option for us financially. Actually, Oracle did a very quick POC for us, and
Right.
that actually helped us in taking the call very quickly, and we immediately migrated to cloud infrastructure. You won't believe, in 10 days flat.
Oh,
And
wonderful.
so that was a huge thing for us. So in our second phase of implementation, actually, which consisted of implementing the solution across 324 labs. Initial was 85 labs. In the second phase, we implemented it in 324 hub labs and around 2000 validation centers.
Mm-hmm.
So naturally, Oracle became our first choice, and we directly actually went for cloud installation instead of going for the local server. And this has helped us in reducing our capex, and have also given us better control of our data, which we are now able to consolidate and use without much issues.
Okay.
I think Amit would like to add something more here. Amit, would you like to add something here?
As you just mentioned that one of the major factors was the time it took for us to implement the solution. This was actually, I would really want to congratulate the Oracle team equally, because the support that we required at that time, and the effort that your team put in was really commendable. Second really important thing was, then when we are looking to implement a project, a cloud-based project at such a huge scale, and we also have to keep future scalability in mind. I think the ease of the interface that OCI offers, plus eventually financial implication becomes a key decision matrix when we come to such solutions. And we believe that Oracle is not only the one of the best solutions that is available, but also one of the most cost effective solutions. And this is something which really not just here, but maybe also in our future products, we'll be really inclined to use Oracle throughout, because we have been very happy with the results that we have had.
So that's a wonderful feedback, Amit and Manish, and we are honored to have a partnership with you, and looking forward to growing it together. So so if I have to ask you, like I know that we've addressed some of the points, but if you have to list, say, the top three capabilities in Oracle Cloud Solution that addressed your challenges, what would those top three would be?
So actually, I will list out two uh, things from business perspective. Probably Amit can add more from a technical standpoint. Actually, you know, first thing that first thing was addressing scaling, which Amit also pointed out actually, which has been actually, for us, it has been instant in since we moved on to Oracle, and smooth actually, which is smooth. And whenever we required to scale it up, or in some cases we had to scale it down as well. So
Mhm.
that has also been very smooth. And secondly, I mean, to Oracle's credit, I would say that we have never faced any outages yet, at least that I am aware of in our association of last almost 10 months now. Amit
Right.
probably would be able to add more insight to these things. Amit?
I think from a technical standpoint, one that I've already mentioned, scalability is a big factor. Second, I think your MDS services are tremendous. The number of database schemas that one instance can support, and how seamlessly we are able to integrate and extract data out of MDS is something that we have been really impressed with. It's a really wonderful solution, and that has helped us a lot in terms of the data insights that we are able to further offer to our customers, which is the government in this case.
That is excellent, Amit and Manish. So that brings me to the next question. How has this experience, changed the way you do business and support your stakeholders? I mean, your customers, employees, management. What can you do now that you could not do before the OCI implementation?
See, one thing is, if we were using a previous solution in which we had an on-prem setup, uh, it typically had a lot of downtime. I mean, we would have up to 5 to 8% of downtime in a month. But since we have migrated to OCI, the downtime is down to zero. So that's how employees have impacted. But the biggest impact, I am sure, has been felt by our customer, which is the government of Madhya Pradesh. And it's a very significant outcome that we are able to offer to them. Previously, also, they would reach out to us for data because they need these data points for downstream analysis for better program implementation. But previously, anytime that they would have their key stakeholders, key decision makers in the government to sit together and find that out, the format in which we would be able to present that data to them, and also the speed at which we'll be able to provide to them, was far less quicker as compared to how we can do it now. Now we have been, because through MDS services, we have created a centralized monitoring dashboard. They're able to see live data points. They're able to see any outages, any breakdowns, any incidents that occur across any of these 2000 plus collection points and labs across the state. And also they are able to better manage the efficiency of their own staff, which are on government payrolls. Their training capabilities have been improved, and the biggest impact is in program implementation. Typically, if I had to just make an example, give you an example, there's a big initiative on eradication of sickle cell disease, and the government has also been big on tracking hemoglobin levels of at the population level.
Mhm.
So now, at a click of a button, they are able to see the impact of their programs, the health schemes, and say, supposing anybody wants to know that in a very remote village in one of the most backward districts of Madhya Pradesh, if they wanted to see how many teenage girls, say between the age of 13 to 17, have hemoglobin less than 7, it's available to them at the click of a button, which was
Oh,
not previously possible.
oh, that is excellent. I mean, yeah. So so that the fact that we have been able to contribute in partnership with you to such a noble cause makes me really really honored, and yeah, and so that brings me to my last question. So how did you find this partnership with cloud engineering team, and any feedback on further improving our service?
Mhm. So actually, like I previously said, and Amit has also added to that. Until now, we have not faced any issue. I mean, nothing to speak of, and we are continuously scaling up and leveraging the services to the extent that we got a feedback from Oracle team that we have stretched things to such a great extent that even Oracle team was surprised, and to the credit of our team and Oracle. And they have all been very supportive since the beginning, starting right with Shrikant, who was instrumental in bringing us on board, and Shilpa, who did the quick POC and has been always very supportive. and now Piyush and Prakash all have been very sensitive to our needs. And also, I mean, we have spoken to you as well a couple of times. I mean, at least I have spoken to you a couple of times together, and we have always felt that everybody is very sensitive to our needs and are always very responsive. And I would like to say something like they said in one of the Malayalam movies. Actually, a similar translation I would do. Actually, Oracle, it's kind of an ocean, and we are a small boy standing on the shore of it, hoping to learn swimming in that vast ocean. So it's been a very fulfilling journey for us until now, and I hope it remains the same.
Absolutely, absolutely.
Amit,
Thank.
would you like to add something else
Sure.
here?
I can't really actually. There have been so many several instances where we needed urgent support. I mean, this is the best thing that I mean, I like about the Oracle, your team here at Oracle. There have been cases when because our labs run 24/7, and there sometimes we need some very urgent support. Like for instance, in one case, the government really decided at a 3-day notice that they wanted to conduct health camps in 330 different locations where we don't have labs right now. And in 3 days time I reached out, and fortunately or unfortunately this fell on a long weekend. It was a 4-day long weekend, but then I reached out to Shilpa, I reached out to Piyush, and within a minute my call was answered. They arranged all the necessary people to come on board in half an hour, 1 hour's time, and we were up and running by the end of the day. So government gave us 3 days notice, and we were able to deliver in one day, and that is thanks to all the support that we received from Oracle. By our own selves, we might have found ourselves inadequate to be able to do that. And this is the kind of support in my opinion bring a long-term relationship. And
Wonderful.
we really happy, really very happy with all our all the experience that we have had with every member of the team at Oracle.
Wonderful, wonderful, Amit and Manish, for your feedback. And I mean, yeah, it's really wonderful to listen to you, your insights, and as I mentioned, the very fact that we at Oracle, in partnership with MediEquity and Science House, have been able to contribute to such a noble cause as healthcare. It makes us really proud. I I personally, am looking forward to growing this relationship further, and obviously together. And thanks again, Manish and Amit, for your time today. It was really wonderful speaking to you. Have a good day.
Thank you,
Thank you.
Shubham. Thank
Thank
you,
you so
Nitin.
much.
Thank